So we had a whole bunch of diseases that we looked at in this paper. We looked at government data on glyphosate usage and government data on human disease patterns over time from hospital discharge data. And we found striking correlations between the rise in glyphosate usage and the rise in a number of health issues in newborn babies. And these are some of the ones that are discussed in this paper: head and face anomalies, blood disorders, skin disorders, metabolic disorders, genitourinary disorders, congenital heart conditions, and lung problems. And all of these have extremely high correlation coefficients. The rise in these diseases in this database compared to the rise in the use of glyphosate on core crops. So R is the correlation coefficient characterizing how similar the two curves are. 1.0 is the highest value it can take, representing a perfect match. So all of these are very close to a perfect match. And here's just an example of one of the graphs from that paper. You can look up this paper if you want to see all the other images that we have in the data that we show. This is congenital heart conditions in the newborns and enlarged right ventricle in adults, two different kinds of heart problems. Both of them have extremely low p-values for the probability that this could have occurred by chance. The green is the enlarged right ventricle, and the blue is congenital heart problems, and the red is the glyphosate usage on wheat, corn, and soy. And this is over time from 1997 to 2010. So then just looking at heart issues, try to find the literature. There's a nice review paper, again, Seralini, he was the one that published the one with massive mammary tumors in the rats. Glyphosate-based herbicides potently affect cardiovascular system in mammals, and this is a review of the literature. And they found evidence of disruption of the heart in terms of long QT syndrome, atrioventricular block, arrhythmias in both humans and animals. And then a quote: in fatalities, the common symptoms were cardiorespiratory arrest, cardiovascular shock, hemodynamic disturbances, that's like blood clots and hemorrhaging, intravascular disseminated coagulation, which is massive small blood clots throughout the vascular system, and multiple organ failure, which is a consequence of that. So quite a mess with the vascular system and with the heart when there is a high dose exposure to glyphosate. So this was another topic that we looked at: genitourinary disorders, things like hypospadias and hydrocele. These are deformities that in the newborn male. So swollen testicle is this hydrocele with water in the testicle. And the other one, hypospadias, is where the urethra comes out too low. It should come out at the tip, and it's nice. It's just someplace else on the penis. And so this is glyphosate usage is the red box, and the disorders, all of them together is the green. And there's certain ICD codes you can read here that define what this represents. So is glyphosate causing an epidemic in fatty liver disease? I think so, and I think there's pretty clear evidence that it is. There's a worldwide epidemic today in fatty liver disease. And so this paper by Robin Ménage et al., 2017, multi-omics reveal non-alcoholic fatty liver disease in rats following chronic exposure to an ultra low dose of Roundup herbicide. Again, this low dose is coming through in all these new papers. And then this is another paper that showed that glyphosate is correlated with fatty liver disease in humans. Really nice paper by Mills, also very recent, 2020. They looked at people who had fatty liver disease, compared them to people who didn't measure urinary glyphosate, found statistically significant more glyphosate in the cases versus the controls. And even when they looked at the people who had liver disease, the ones with more extreme disease had higher levels of glyphosate, statistically significantly higher levels than the ones who had a less advanced form of liver disease. And then kidney failure is another thing that we're seeing, particularly in agricultural workers. This is quite disturbing in Central America and also in Sri Lanka. And there have been a number of papers that have been written about this strange disease. It's sort of an unusual type of kidney failure that looks like a toxic, some kind of toxicity in the kidneys. And, and there are agricultural workers in the sugarcane fields in Central America. And then I think the Sri Lanka is rice paddies in Sri Lanka. They're dying at a young age in record numbers from kidney failure. It's the second most common cause of death in young men in El Salvador. And they've attributed it to a number of things in various studies, and certainly arsenic and cadmium are among the possibilities from the use of arsenic as an herbicide. And then nitrates are also an issue, nitrates in well water, but then they're thinking that glyphosate is working synergistically with these other toxins to cause increased toxicity. And so that's this paper here by Jaya Sumana. which was in 2014. So glyphosate chelates arsenic and then unloads it when it gets to the acidic environment of the renal tubules. That's a very interesting concept, that it would hand carry the arsenic into the kidneys. And then when you get into an acidic environment, glyphosate lets go of the minerals, of the metals that it's chelating. And then this paper talks about synergistic toxicity with paraquat, because both of them were being used at the same time. And together they work, they become more toxic than either one. Each of them makes the other one more toxic than it would otherwise be, to destroy the kidneys of the agricultural workers in Sri Lanka. And so kidney disease is not just among the agricultural workers, because we're seeing a rise in kidney disease. This is death due to renal failure in the United States over time, correlating with both the glyphosate usage, which is the red, and then also the GE, the percentage of genetically engineered Roundup Ready soy and corn crops. Both of those are sort of working right around this rise in the kidney disease. So I think that very clear evidence that there's at least correlation between these phenomena. And now, so this is just more and more of these diseases. I've been looking at so many diseases, as you can see, and I've written various papers. This is also with Nancy Swanson. She and I collaborated on many papers, digging through this databases from the United States government, looking for correlations. And this is quite remarkable, what we found with respect to various neurological diseases. Autism, of course, is the one I was most interested in, extremely highly correlated with a rise in glyphosate. ADHD, which is this hyperactivity deficiency, hyperactivity disorder, schizophrenia, anxiety. And then this is interesting, sleep disorder, very, very highly correlated. We hear a lot of chatter these days about people having trouble sleeping. And I suspect if they would go to a certified organic diet, that would be the best thing they could do to improve their sleep. And of course, sleep disorder is also linked to many of these other diseases. So this is also a new paper. Well, this is 2015, but I only found out about it recently. I was fascinated by this because this bug, Proteus mirabilis, it can fully metabolize glyphosate and use its phosphorus atom as a source of phosphorus. So this is showing if it's got phosphorus here, the growth rate over time. This is no phosphorus; it's completely unable to grow. But you can give it glyphosate as an alternative to phosphate, and you'll be able to use the glyphosate as a source of phosphorus and grow pretty well. And so this means that this is going to be very. It will remove glyphosate, but it will also be able to thrive because of that. That it can be resistant to glyphosate because it can remove it, and so it may be connected to, I think, to the rheumatoid arthritis, which is an autoimmune disease that's triggered by this Proteus infection, in urinary tract infection. And this is just a paper that talks about that, where you get the urinary tract infection, you develop antibodies to this Proteus microbe, and then those antibodies become autoantibodies due to molecular mimicry, and they attack the human protein here, which then causes cytotoxicity in the synovial tissues in the joints, and then that ends up with the rheumatoid arthritis. So that's quite interesting to me. I think we should be looking for diseases that are affected by microbes that have some kind of ability to fight, to be safe in the context of glyphosate, or to even be able to metabolize glyphosate, which becomes actually a benefit for the host if they can remove the glyphosate, but at the same time they cause disease. Glyphosate in the gut. So imbalance in gut microbiome is something that's been a big topic in recent papers. There's lots of really interesting, very complex papers about the gut microbiome and various distributions associated with different diseases. But gut microbiome imbalances are causing many, many different diseases: inflammatory bowel disease, autoimmune arthritis, obesity, metabolic syndrome, non-alcoholic fatty liver disease. They can all be traced to imbalances in the gut microbiome. And then here's a picture showing this gut microbiota and all these different conditions that can be affected by these being out of balance. And so glyphosate has been shown to affect the gut microbiome, and in fact, it's been shown to preferentially kill beneficial microbes, which allows the pathogens to flourish. This causes a leaky gut barrier through inflammation. It causes immune cells to infiltrate into the gut tissue, and they release these inflammatory cytokines that then cause increased risk to all these diseases: Crohn's and ulcerative colitis and celiac disease, which is gluten intolerance, another thing that we have an epidemic in. And this is just showing the leaky gut. The microbes and various materials escape the gut. These immune cells come in, and then they release these inflammatory signals that then cause tissue damage. So here's inflammatory bowel disease, another one of these papers from Nancy Swanson. This particular paper from 2014 has something like 30 different figures of different correlations of glyphosate usage over time with various diseases. And inflammatory bowel disease is one of them with a very, very low p-value, very high correlation coefficient. And this is another plot, a Nancy plot, and Samsel and I published a paper in Interdisciplinary Toxicology on glyphosate and celiac disease. And we showed in that paper that glyphosate usage on wheat, this is just wheat, correlates well with celiac disease. That's the yellow boxes. Pretty good match there. And so this is suggesting, I believe it's actually the case that glyphosate is a major causal factor in the epidemic that we're seeing today in gluten intolerance, and probably in a lot of the other food allergies that we've been experiencing today. There's just so many more people who are sensitive to various foods today than there were when I was a child. I didn't know anybody who had any kind of food sensitivities. It was quite shocking how much that has changed over time. So this is, again, Samsel and I did this study where he actually got a hold of some enzymes from porcine enzymes of trypsin, pepsin, and lipase from a lab, from a chemical lab. And he tested them for glyphosate and found high levels of glyphosate in all three of them. And I think this is disrupting their ability to perform their enzymatic function. So this prevents proteins like gluten from being properly digested. And then the undigested proteins induce a release of zonulin, which then opens up the gut barrier. And that allows the undigested proteins to get into the general circulation and cause autoimmune disease. And so here's just some correlations: celiac disease, glyphosate, and non-Hodgkin's lymphoma. Glyphosate preferentially kills the class of bacteria called bifidobacteria, which are very, very important in the early days of the infant's life. These bifidobacteria have been shown to be depleted in association with celiac disease. And celiac disease is also associated with an increased risk to non-Hodgkin's lymphoma. In fact, that's the main reason why people with this disease tend to have a shortened lifespan. And then glyphosate itself is also, of course, also directly linked to non-Hodgkin's lymphoma. And we know that from all these successful trials in court. So glyphosate and autism, this is a plot that I was really opened my eyes to the possibility of glyphosate causing autism. And I still feel very confident that I'm right, that glyphosate is the primary, it's not the only, but it's the primary reason why we have an epidemic in autism today, which is a shocking epidemic. It's 1 in 54. Currently, the 12-year-olds have autism, according to the CDC. It's a shocking number. And so this paper that I wrote together with James Beecham, published in 2016, discusses some of the ideas for how glyphosate could be causing autism. And just looking at Clostridia, because Clostridia seemed to play an important role in autism, you can see that this was a paper that showed the different microbe sensitivity to glyphosate. And the ones that are small here have very high sensitivity. It knocks them way down. Bifidobacteria in particular is the lowest of all of these that are shown here. Clostridia and Salmonella, on the other hand, are quite hardy against glyphosate. So they thrive. When these other microbes get killed off, these two thrive, and you get disease, you get infections. And Clostridia in particular seems to be very tightly coupled with autism. This was a study that looked at 14 autistic children with gut disorder compared to 21 controls. They saw this significant increase in Clostridia species in the autistic kids, which was associated with reduced tryptophan levels and increased expression of inflammatory markers. Those are both going to be characteristic of glyphosate because tryptophan is one of those aromatic amino acids that comes out of the shikimate pathway. And then the macrophages in the inflamed tissue, they actually take up tryptophan, reducing the bioavailability of it to the brain. Tryptophan is a precursor to serotonin, and serotonin is extremely important in the brain. Both serotonin and melatonin come out of that pathway. And so they propose in the paper that antibiotics could be causing the problems. Glyphosate is a patented antimicrobial agent, and so it too can be seen as an antibiotic to cause these problems that they were seeing with these kids. This one is even more striking because he specifically looked at glyphosate. This paper from 2017, elevated urinary glyphosate and Clostridia metabolites with altered dopamine metabolism in triplets with autistic spectrum disorder or suspected seizure disorder case study. So with three kids, 2 boys, 1 girl. Both of the boys were diagnosed with autism. The girl had a seizure disorder. All 3 of them had very high levels of glyphosate in their urine. And then he detected the Clostridia overgrowth, which he suspected was due to glyphosate's disruption of the gut microbiome. Clostridia produce toxins which actually block the conversion of dopamine to norepinephrine. So you get excess dopamine in the brain, and dopamine can become very damaging to the neurons. It can become neuroexcitotoxic through oxidative stress if it can't be converted to norepinephrine. And this is a paper, a recent paper, 2019, where they look at gut microbiota and neurological effects of glyphosate. In this work, we state a possible link between glyphosate-induced dysbiosis and cognitive and motor aggravations in neurodegenerative and neurodevelopmental pathologies, such as autism. Hence, we review the negative impact that glyphosate-induced dysbiosis may have on depression, anxiety, autism, Alzheimer's, and Parkinson's disease. And all of these diseases are going up dramatically in step with a rise in glyphosate usage. Here's a paper from 2020. Autism-like symptoms following maternal glyphosate exposure. And this was a study where they exposed the mice to glyphosate during pregnancy, and they looked for the risk for autism in the progeny. So the pregnant mice had high-dose glyphosate in this case during pregnancy and lactation. And then they saw that it was autism-like symptoms in the offspring, and also that they had an imbalanced gut microbiome and disrupted fatty acid metabolism. And they particularly noted an enzyme called soluble epoxyhydrolase, soluble EH, in the prefrontal cortex of the brain of these offspring, which produces pro-inflammatory fatty acid derivatives. So this is a fatty acid. This enzyme does this funny thing, putting this oxygen in here. This is a very active signaling molecule that induces oxidative stress and inflammation. And this elevation of this enzyme has been linked to many different diseases: depression, autism, schizophrenia, and Parkinson's disease. So how to explain all this? The story links together vitamin D, cytochrome P450 enzymes, aromatase, estrogen, testosterone, and soluble EH. So because maternal vitamin D deficiency causes high testosterone in the male offspring, aromatase deficiency causes low estrogen because aromatase converts testosterone to estrogen. And so estrogen actually suppresses this enzyme. But because the estrogen is not being produced because the aromatase is defective, you end up with overexpression of this enzyme, and then you get this oxidative stress and inflammation. Vitamin D activation depends on cytochrome P450 enzymes, which are blocked by glyphosate. Aromatase also is a CYP enzyme. So all these enzymes are getting disrupted, and that gives you the low estrogen, the low vitamin D, and the high SEH that's characteristic of these animals. So here's just some data on that. Here's a paper showing that glyphosate suppresses aromatase in the placenta. And these were agricultural workers, female agricultural workers, using glyphosate had fertility problems, showing that the placental cells were exposed to glyphosate had suppression of aromatase expression, which is going to mean then excess testosterone and insufficient estrogen during development. And they showed that the additional ingredients in Roundup also increase the glyphosate toxicity. And so here's a developmental vitamin D deficiency increases fetal exposure to testosterone. So this is just showing that vitamin D needs to be high in order to lower the amount of testosterone exposure in the brain. It regulates the expression via methylation. So you get hypermethylation of the promoter, which then turns down the gain on the expression of aromatase. So this is another way to cause the aromatase deficiency. On top of the fact that the enzyme itself gets suppressed by glyphosate, it also gets suppressed by this problem of vitamin D deficiency. And then they've shown that excess testosterone during development leads to autism in males. And this is just showing the CYP enzymes. These are all the different CYP enzymes in the liver that are able to convert vitamin D, which is this one, to this 1,25-hydroxy vitamin D, which is the active form of vitamin D. These enzymes are all involved in doing that. Here's a paper: glyphosate exposure induces synaptic impairment in hippocampal neurons and cognitive deficits in developing rats. So this is quite remarkable because it showed that the neurons, when grown in culture exposed to glyphosate, they showed a decrease in this dendritic complexity and spine formation. It turns out this is a characteristic feature of neurons in autism. They were exposed to glyphosate every 2 days from 7 days old to 27 days old, and they showed cognitive impairments and reduced synaptic protein expression. Very important in the hippocampus, because the hippocampus is a central player in autism in humans. And so this is another paper that just shows that this is true for neural development and axon growth are altered by glyphosate through a Wnt non-canonical signaling pathways. This is getting into the actual biochemistry of it. They grew these neurons in culture, they exposed them to glyphosate. Same thing, they lost all these dendritic branches. These neurons became very naked, so to speak, not developing properly. And that's a characteristic feature of autism, as shown by this paper. Specifically, autism has been linked to a decrease in the density of spines with mature morphology, indicating a general spine immaturity state in autism, exactly what you're seeing with the glyphosate exposure. And so this paper shows, looking again at neural stem cells grown in culture from this critical zone, subventricular zone of the mouse. They demonstrated permissible concentrations of glyphosate in drinking water that are recognized by the EPA to be safe. They're capable of inducing neurotoxicity in the developing nervous system. So they say our findings signify the need to review the safety standards established by environmental protection agencies concerning safe glyphosate concentrations in drinking water. To recapitulate all of this, glyphosate causes overrepresentation of Clostridia in the gut, depleting tryptophan. This maps to brain damage through inflammation. It causes autism-like symptoms in male mice linked to increased expression of this soluble epoxy hydrolase. Estrogen decreases the expression, aromatase converts testosterone to estrogen, aromatase gets blocked by glyphosate, and so this doesn't happen, and you get this overexpression of this enzyme. And this explains glyphosate's effects and linked to autism. Low estrogen leads to high SCH. Maternal vitamin D deficiency leads to excess testosterone in the males. Vitamin D depends on the liver CYP enzymes, which are suppressed by glyphosate. And aromatase itself is a CYP enzyme, and that explains how glyphosate could suppress it. And then glyphosate suppresses the maturation of these neuronal dendritic spikes in the brain, which is a characteristic feature of autism. So glyphosate and endocrine disruption. Glyphosate is an endocrine disruptor. This is a new paper from 2020. It's a review paper. It has a lot of references, and it has all these different references showing various evidence of glyphosate disrupting the endocrine system. And the endocrine system consists of all these glands, and they produce a whole bunch of hormones, like thyroid hormone and the sex hormones. And many of those hormones are obviously disrupted by glyphosate. One paper showed that very tiny amounts of glyphosate cause breast cancer cells to proliferate. So it's like an estrogenic effect. It increases the expression levels of estrogen and progesterone receptors. It disrupts the hypothalamic pituitary thyroid axis. It alters circulating levels of various hormones. It induced hypothyroidism in female Wistar rats. It altered reproductive development and parameters in animal models. And this one is a very interesting, malformation in zebrafish embryos. So these are just all these different papers are referenced here that explain all of these effects of glyphosate, obviously showing that it is an endocrine disruptor. Zen Honeycutt is a friend of mine. She's the founder of Moms Across America, a great advocacy group trying to get the message out about the dangers of glyphosate in our food. And she actually is very active politically. She actually went to a developmental and reproductive toxic identification committee. She met with them and presented slides arguing that glyphosate is an endocrine disruptor. This is in California, where she was at the time. And the California's EPA office was assessing the health hazard, was running through a health hazard assessment of various chemicals with the potential of considering labeling some of them as being officially an endocrine disruptor. And her slides were very powerful. And because of those slides, the committee voted that glyphosate should be labeled as a high probability endocrine disruptor on the Prop 65 list. And, California had also listed glyphosate as a probable cancer causing agent, which has caused the Monsanto to be quite upset. So this is a new paper, again, 2021. Maternal urinary levels of glyphosate during pregnancy and anogenital distance in newborns in a U.S. multicenter pregnancy cohort. A very interesting and significant paper, I believe, which showed they measured the glyphosate levels in the urine of the mother mid-pregnancy, and they measured this metric called the anogenital distance in the girls. If it's long, it's an indication of more male-like typical profile, which indicates excess exposure to testosterone in utero, which is what we're going to expect with this suppression of aromatase. And so it makes sense, in terms of biochemically, it makes sense that this would happen. And they had done an earlier study on rats where they had found a similar result. And again, this is the aromatase problem, and this confirms that glyphosate is an endocrine disruptor in humans. And in fact, this metric is an indicator of a much higher risk to developing a syndrome called polycystic ovary syndrome. which is something that's quite an epidemic these days. We have something like 20% of the world's population are suffering from PCOS. And this is associated with infertility problems, irregular periods or no menstrual cycle, excess hair growth, and obviously the impaired ability to have children. And so also an increased risk to being diagnosed with autism or to having progeny with autism. So quite interesting, this syndrome, which is caused by glyphosate due to the excess testosterone in utero, is causing all of these problems. Glyphosate in premature birth, another recent paper, 2021, a study based in Puerto Rico, 53 cases of premature birth compared to 194 controls. They adjusted the models for a number of different adjustment conditions. They measured both glyphosate and AMPA. AMPA is a breakdown product of glyphosate. And the women who had high levels of AMPA, which they defined as greater than 0.65 micrograms per liter at 26 weeks of gestation, close to the end of the cycle, they had a 4.5-fold increased risk of having a premature baby with a very high, very significant p-value. And high urinary glyphosate was also associated with a slightly lesser 3.77-fold increased risk. Premature birth is a national epidemic, and it's especially bad in Puerto Rico, one of the highest numbers of premature birth in Puerto Rico compared to the other states. It's costing the United States $26.2 billion per year. Another new paper, 2021, glyphosate sperm counts in cancer. This paper was quite amazing to me. They had these plots, and I've put them up here. Sperm counts, testicular cancer, and non-Hodgkin's lymphoma. And they're looking at places across the United States, looking at the sperm counts, comparing them to glyphosate usage in that region. So this is a spatial analysis of glyphosate usage across the country. And they showed very striking p-values here, extremely low p-values for all three of these patterns of the correlation between these conditions. Non-Hodgkin's lymphoma, testicular cancer was fantastically highly correlated with glyphosate. And then the sperm counts, of course, is probably connected to testicular cancer because it's showing the glyphosate is damaging sperm. And other data, other papers that I have on file are also showing damage to the sperm directly by glyphosate. This is glyphosate-based herbicides produce teratogenic effects on vertebrates by impairing retinoic acid signaling. That's another one of these endocrine disrupting effects. And retinoic acid actually depends upon cytochrome P450 enzymes to be removed. And during development, you have to have very critical increases and decreases of retinoic acid under critical control in order for development to work properly. And so what happens is you get excess retinoic acid because it's not being removed by CYP enzymes, just like the testosterone problem. And it causes inhibition of these various enzymes, which then leads to all these different developmental disorders in the neural crest. The cyclopia is one eye, small brain, various effects of the craniofacial malformations. This experiment was done with tadpoles. Transgenerational effects. Just a couple slides here. Developmental exposure to glyphosate-based herbicides and depressive-like behavior in adult offspring, implication of glutamate excitotoxicity and oxidative stress. And this is an important paper because they exposed to the mother rats to glyphosate while they were pregnant and for 15 days following the birth of the offspring. So only the mothers were exposed, not the offspring, not directly. Then the offspring suffered from glutamate excitotoxicity in their brains. And that's something that's also shown up in many other papers that I have on file on glyphosate, showing glutamate excitotoxicity, along with the dopamine excitotoxicity that we're seeing as well. And this excitotoxicity persisted even after the exposure was terminated. When the offspring were 60 days old, they showed signs of depression in a forced swimming test. This is this kind of test that you can use to see how they respond to a stressful situation. Now, this one is quite amazing. And there's actually a couple papers here. Really, it's the same group, I believe, and it's really fascinating studies where they exposed pregnant rats to glyphosate at a very low level, half of the no observable adverse effect level, from day 8 to day 14 of gestation. They timed it to match the time when the germ cell epigenetic programming takes place. So the female fetus develops her germline, her future cells for her future children, before she even develops, like in very early stages of pregnancy, the first third of pregnancy, this happens first before the fetus actually develops into a full-formed animal. And so they expose them to glyphosate at that critical period. And so then they took the offspring, they bred them to produce pups and grandpups and great-grandpups, so 3 different generations. And then the exposed rats looked fine. They had no obvious symptoms. The F1 generation were mostly fine as well, the ones that were in utero at the time that they got exposed. What was interesting is you started to see effects in the F2 and the F3 generations, and they suffer from many diseases, including mammary tumors, delayed or early puberty, premature birth, prostate disease, kidney disease, and obesity. All these things started to show up in the later generations, and even more in the F3 than in the F2. So this is what's called epigenetic effects, where the germline is actually remembering the experience that it had in utero, and it's marking itself in special ways to remember that, and that's causing a programming change in future generations that takes a long time to disappear. Very, very interesting. So my new book, Toxic Legacy, expected to be released on July 1st, very soon, presents extensive data on glyphosate toxicity to animals and humans. It provides compelling arguments that glyphosate is insidiously, cumulatively toxic through its diabolical insertion into proteins by mistake in place of the coding amino acid glycine. That's the central thesis of my book. And I explain it biochemically, how that can justify how one chemical could cause so many different diseases. So I hope you'll check this out. How to stay healthy in a toxic world. We're wrapping up with the last little bit. Obviously, go organic. This is a picture of my kitchen table, and we pitched all of our non-organic food at one point, sometime in 2013. You know, we just let it all go and started over, and we bought everything organic, even our spices, our beer, our wine. All of our food is certified organic, and if we can't find it certified organic, we don't eat it. And I would encourage all of you to think about doing that as well. Here's the difference between non-GMO versus USDA organic. People often think non-GMO is good enough, but of course that's not true, because they allow synthetic pesticides, they allow Roundup in particular, hexane, sewage sludge, antibiotics, ractopamine. These are all bad things. So there's many, many reasons to go certified organic to get healthy food, not just glyphosate. I encourage people to eat a lot of natural probiotic foods. I eat apple cider vinegar every day. We always make a big salad, and we make our own salad dressing using this Bragg's organic. Things like kombucha and kimchi and sauerkraut, these are all very healthy foods that will help to maintain healthy microbiome. I have identified several nutrients that I feel are important. I like Epsom salt baths. I think that's a nice way to get sulfate. In my book, I talk a lot about how glyphosate messes up the sulfate system. I didn't have time to cover that here because it's kind of technical, but you can read the book to find out about exactly how that happens. But I like to try to get a lot of sulfur, foods that are rich in sulfur, and I love garlic. We eat a lot of garlic and onions. Vitamin C is also important for metabolism. Methyl tetrahydrofolate, but not folic acid. B12, this is B12, cobalamin. This is also getting messed up by glyphosate. N-acetylcysteine is a good source of sulfur. It's a natural organic sulfur compound. And glutathione, of course, is too. Glutathione contains cysteine as one of its 3 amino acids. Taurine is also a sulfur-containing amino acid. It's high levels in fish. And curcumin, of course, is a wonderful spice. They use it a lot in India, and I think that's one of the reasons why they have reduced levels of Alzheimer's disease. So these things are all herbs and spices in general. I really encourage, important to eat lots of them in your food. This was an interesting paper on glyphosate poisoning in cows. The cows had high levels of glyphosate in their urine, and they were sick. And they fed them sauerkraut juice, bentonite clay, activated charcoal, and fulvic and humic acid. Very interesting combination of natural things that were used to help to reduce their levels of glyphosate and improve their health. And this was one on chickens that was done, where they used biochar, bentonite, and zeolite to maintain healthy microbial distribution in the poultry. So these are ways that I think that you can try to combat glyphosate exposure. Here's another one which is quite interesting. All these kind of weed plants actually have the ability to protect you from glyphosate. So this was a paper that talked about Roundup being toxic to liver cells and embryonic cells at low doses. And they extracted common extracts from common plants like dandelions, barberry, and burdock. And especially if you have them before exposure, they can help to reduce the damage caused by the Roundup. Healthy living is the best way to protect yourself from COVID-19. Vitamin D deficiency is associated with a 4-fold increased risk of dying from COVID-19. And I find that very interesting because we have an epidemic in vitamin D deficiency in this country. And I believe it's partly, or even perhaps mostly, due to the inability of the liver and the kidneys to activate the vitamin D to turn it into its active form. So you need those CYP enzymes to make the 1,25 hydroxy vitamin D that is the active form. And vitamin C and vitamin K2 deficiencies are also linked to poor outcomes. Vitamin K2 in particular comes out of the shikimate pathway. Countries where fermented foods are a dietary staple have, in general, lower infection rates than countries where they're not. And I believe the most important way to protect yourself from glyphosate, from COVID-19, are to eat a certified organic whole foods diet, nutrient-dense diet, and to get out in the sunlight without sunscreen and without sunglasses. And I talk a lot about the sunlight in my book and how it can help to improve your health. Conclusions: glyphosate is far more toxic to